The first thing I ask patients is, are you stiff, and are you stiff in the morning? Generally, other causes of arthritis, such as osteoarthritis, can cause some stiffness, but no longer than 30 minutes. But when a patient says that they're stiff for an hour or 2 hours, maybe all morning long, I start to think about rheumatoid arthritis because that suggests inflammation. Rheumatoid arthritis is an autoimmune disease, which means that the immune system, which is supposed to be your protection against viruses or bacteria, becomes active against your own tissues. And in rheumatoid arthritis, these are the joint tissues. It affects joints that aren't necessarily the ones that you use more often. So even the knuckles or the elbows, joints that are not necessarily weight-bearing can be involved in rheumatoid arthritis. And RA joint pain tends to be symmetrical. So if it affects one or two joints on one side of the body, it tends to affect the same joints on the other side of the body. We would almost rule out someone who has maybe one or two joints affected. So we're really looking for multiple joints, symmetric on both sides of the body. And usually patients who have rheumatoid arthritis will say, if I wake up in the morning and I'm stiff, I take a hot shower, and the warm water from the shower will help to loosen my joints and make them feel better. Or they'll tell me that they are using their joints more, and the more I use my joints, the better I feel. So those are signs that this might be rheumatoid arthritis rather than other sorts of joint pain. Along with the joint pain caused by RA, patients tend to have systemic symptoms. And again, this is because the immune system is active. So it's similar to when you've got a cold or a flu. If the immune system is active, you've got some fatigue, maybe low-grade fevers. You sort of feel like you're ill. The first thing that a person who suspects they have rheumatoid arthritis should do is contact their primary care physician. So the primary care physician can help to do an initial workup and then refer to a specialist who would be able to diagnose it definitively and start therapies. It's imperative to get treatment as early as possible because the inflammation doesn't just cause pain, it also causes damage to the joint structures and to the bone. Before we had state-of-the-art therapies, patients would end up with deformities and be unable to use their joints at all. And we can protect against that if we control the inflammation to the best of our ability.